According to new reporting released by Canadian Affairs, Canadian dentists were alarmed by Ottawa's proposed new dental care plan. Dentists expressed their concerns about low fees and complicated new administrative processes. This could potentially add extra work and delays before every appointment to verify a patient's eligibility with insurers. Joining us now to dive deeper into these issues is the author of that Canadian Affairs article, journalist Hadassah Alencar. Thank you very much for joining us today.
Great to be here.
So how does the administrative burden outlined in your piece differ from the current practices in dental offices now?
So what happens now when someone goes to the dentist for any treatment that's covered under their insurance is that the dental offices will submit the claim electronically to the insurance company on behalf of the patient. So the patient will still pay the cost of the treatment up front and will wait to be reimbursed by their insurance. And those that go to the dentist at least every year will know that this takes just a few clicks for those working in the dentist's office to submit the claim. It's a pretty easy process. But under Ottawa's dental care program, dentists who participate in the plan will have to check with the insurance company to see if the patient's treatment is eligible to be covered. This already happens in another federal dental care program for Inuit and First Nations, and it can take days or even weeks to get approval for treatment. This will also have to happen for every treatment that they come in for. So on one hand, this is awful for patients because sometimes they'll have to wait many days or weeks, like I said, while they're in pain. But for dentists, that'll mean they'll have a growing pile of paperwork waiting for insurance approval. This means more work hours to submit, check up, and follow up on the claim.
And so that obviously adds a significant lag in terms of procedure, but there's also questions about payment. How are the proposed fees under this plan? How do they compare to the provincial guidelines, and why are dentists expressing their concern about how they're reimbursed?
All the dental care associations that I spoke to said that the dental care plan does not meet the provincial guidelines. And these guidelines are made by an economist that the dental associations hire. Those economists, they set the appropriate rates for any given treatment, from doing a crown to doing a filling, and dentists use this as a baseline to determine what they should be charging. Some may even charge more if their business expenses are high. But the sample fee guide that Ottawa recently shared is, like I said, lower than the provincial fee guide. And as an example, I spoke to Julie Waterbury, from the president of the Nova Scotia Dental Association, who said that the Nova Scotia Dental Association sets a filling, for example, at $164, but under the sample fee plan, the coverage was only $108. And so who's responsible for paying that difference is the patients. They'll have to pay the $56 along with any of the other operational fees that aren't covered under this dental care plan. And dentists are concerned that Ottawa promised an affordable dental care plan, but if the coverage rate is too low, it may still be out of reach for many Canadians.
And on the side of dentists, what's the potential financial impact for them, considering what you just described in terms of lower fees and that lower rate being covered? How is this going to impact the bottom line for dentists across the country?
Well, a big impact is that they're going to have higher business costs. And dentists' office right now are already facing a shortage of workers. There are not enough dental hygienists or assistants for many dental clinics to operate at their fullest. And the dental plan right now means that they'll have to take on more work hours to take on the paperwork and the greater number of patients that this program is expected to take in. So the Nova Scotia Dental Association estimates that the dentists in their province will have to work another 36 more days to take on the workload for the dental care plan. And these lower fees simply don't cover the cost of the additional work that the dental clinics are expected to have.
And based on your reporting and the conversations you've had, we have about 30 seconds left here, but how likely is it that dentists may choose not to enroll in the program?
It's pretty likely. all the dental care leaders that I spoke to, they said that they're waiting, and they've told the dentists in their province to wait for more information. But they really feel like their advice hasn't been taken into consideration in the making of this dental care program. And if by the time the final announcements are made in May and June on those fees that we spoke about, on the administrative burden on dentists, then the reality is that many may not choose to participate.
Thank you very much for your time today.